I am Dr. Kimaya Chavan. Today I will be discussing mastering the phacoemulsification technique of cataract removal through simulation-based training. In divide and conquer technique, we create two perpendicular deep grooves using the phacoprobe. We ensure adequate width and depth of the groove for safe cracking. For guiding the depth of the trench, you can see green dots as a training tool superiorly on the screen, displaying the position of phacoprobe and the Sinskey hook. Additionally, a dotted green plus overlay appears on the cataract to guide the correct width and length of the trench. We also have a training toolbar on the right hand side displaying the foot pedal position during phaco. The trenching should be continued until the width of the trench is approximately twice the diameter of the phaco tip and the depth is around 3 times the diameter of the phaco tip, ensuring adequate nucleus division while maintaining safety. While dividing the nucleus into 4 parts, the Sinskey hook is held in the left hand and the phacoprobe in the right hand. The instruments can be positioned either parallel to each other or crossed, applying pressure on the side walls of the trench while reaching the depth of each trench. The training tool at the top with 2 green dots displays the depth of both instruments within the trench. After confirming that all 4 quadrants are completely separated, we begin emulsifying each quadrant. We first embed the nucleus in foot pedal position 3, then transition to foot pedal position 2 to achieve complete occlusion. The phacoprobe approaches each quadrant, ensuring complete occlusion before cracking the nucleus. A training tool provides real-time feedback on occlusion quality, with yellow indicating poor hold and green indicating good hold. Once smaller fragments are created, they are moved to the center of the anterior chamber using vacuum in position 2 and then emulsified in foot pedal position 3. Now let's see the direct chop technique for nucleotomy. The direct chop technique involves embedding the phacoprobe into the nucleus with stable occlusion, followed by using a chopper to split the nucleus into more fragments. This method enhances efficiency by minimizing energy dispersion and reducing stress on the zonules. In this step, we use a chopper in the left hand instead of Sinskey hook. With the phacoprobe, applying vacuum, the nucleus is securely held at the center. The chopper then applies counter pressure at the equator of the lens, effectively splitting the nucleus into 2. This technique is known as horizontal chop. For vertical chop, the chopper is moved towards the center of the nucleus near the phacoprobe, and by applying downward pressure with the chopper while the phacoprobe pulls the nucleus upwards, we efficiently create multiple smaller fragments for emulsification. Using the Sinskey hook or chopper, the smaller fragments are directed towards the phacoprobe to ensure controlled and effective emulsification. And finally, the smaller fragments are emulsified in the same manner as discussed earlier in the divide and conquer technique. The phaco-dynamics involved in the divide and conquer technique, as well as in the horizontal and vertical chopping techniques, are accurately replicated on the Help Me See simulator, allowing realistic practice and mastery. Simulation training for cataract surgery is really a boon for all the novice surgeons. These are the different courses available on Help Me See simulator. Thank you so much for your patient listening.